Will shutting the borders stop coronavirus? The U.S. president banning all Europeans from entering. Will ask if he's right to do so, and if so, why the exceptions for the U.K. and Ireland. At a time when the planet needs to come together to support those in the firing line, allay fears, prevent scapegoating. Will ask if global leadership is up to the task. The travel ban fueling, in part, that panic on world markets that we've seen with some record losses, most notably here in Paris and in Milan. Will measure the response on both sides of the Atlantic and the resiliency of this interconnected world that we live in. The out-of-the-blue shock slowdown in human activity hitting hardest in Italy, which is under lockdown and where the death toll has just crossed the 1,000 threshold. Reactions from its neighbors varying wildly, with some shutting borders to all Europeans. Too much or not enough? And when it's all over, well, will we rethink our very way of living and the creature comforts that we take for granted in our modern world? Today in the France 24 debate, we're asking if we do shut the borders. Joining us, economist Joël Ruet, president of the Bridge Tank. Thanks for being with us.
Thanks.
I want to welcome as well entrepreneur and commentator Jakob Hessler.
Hi.
Nice to see you. Sociologist Rahaf Harfouch, founder of the Red Thread Institute for Digital Culture and adjunct professor at the French Political Science Institute, Sciences Po. Nice,
Hello.
Nice to see you. From Newcastle in England, Dr. Stergios Moskos, molecular biologist at Northumbria University. Welcome to the show.
Hello.
The France 24 debate on Facebook and Twitter, hashtag F24debate. Yeah, after a Black Monday for markets, welcome to Black Thursday. It took 1 week for the Paris Bourse to lose 20% of its value. 20% is what they call a bear market. This is the Dow Jones earlier. It's rebounded a little. It was down 9% as we're taping this. It was down somewhere between 6 and 8%. This after stimulus measures were announced. Yeah, bear markets all around. Jakob Hessler, are the markets overreacting?
Well, I think markets are reacting to the uncertainty that is currently in the, all pervasive. And I think they're waiting for signals as to how governments imagine to maintain continuity of vital infrastructure, which I mean is production, finance, healthcare, basic political systems, and how that is supposed to work, not just in the period where we may have lockdown and social distancing, but beyond. And so far, the signals have been very mixed between some people who still believe that central banks' monetary stimulus could help, when in fact I think probably most reasonable economists from Janet Yellen to Larry Summers would say we need a fiscal stimulus package, which so far only...
But the argument's been made by one trader we spoke to just a short while ago, saying that Christine Lagarde made a communications blunder, the president of the European Central Bank, by coming out and stating exactly what you said, that it's not up to central banks to solve this, it's up to national governments and the European Union as a whole.
No, but the truth is the fact is, even before coronavirus, we were in, you couldn't say exactly a rosy economic situation. We were sidelining, moving aside, particularly in Europe, and we had reached the end of the possible impact from monetary stimulus, which is ironically what the new Brexit government in the UK, being the only government so far, has enacted. When you look at its budget plan, one may not like it, but it is a radical departure from the economic consensus of the past 20 years in the Western world.
All right, so lack of a coordinated response, you're saying. What we are seeing is the shutting of borders. And it all began Wednesday evening with this address from the Oval Office.
The European Union failed to take the same precautions and restrict travel from China and other hotspots. As a result, a large number of new clusters in the United States were seeded by travelers from Europe. To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight.
with the chaos that's ensued in airports and on markets. Dr. Stergios Moskos, was that the right call?
Okay, so my personal opinion, and I'm not an epidemiologist, I'm somebody who's following very closely what the expert epidemiologists are saying, is that the implementation of social distancing in countries or states, in states like the European Union, China, the United States, is essential to make sure that there is minimal person-to-person transmission. The border barriers worked in China. Hubei province is just a state inside China, and movement restriction was put in place between Hubei and the other provinces. That stopped in its tracks the transmission intensity. Now, the rationale as to why to stop the European Union when the difference between some European Union states is a matter of days or a week behind what's happening, what's going to happen in the United States and what's happening in Britain is debatable. But I think right now, the whole of the West, we're all in this together. We better start acting together and learn from what our friends in the Asian states and territories have shown us solve the problem.
You're making the argument that it is a good decision. So, for instance, where you are in the UK, what does that? Yes. Concretely, what should be done?
Look, it's not for me to make a decision or recommendation to the UK. I think everybody who has been reading the news and watching the news and seeing what's happening clearly sees the value of social distancing and reducing person-to-person transmission. So stopping as much as possible interaction between people will have a short-term impact. The rest of the panel can perhaps put some numbers on it and predict it, but in the long term, it will have a less impact than we would otherwise anticipate. I'm sure my peers on the panel can make estimations about which of the two approaches will be much more impactful to society and economy.
We could perhaps call up the reaction of the European Union's spokesperson. It was quite strong this Thursday, denouncing Ralph Arfouche, the fact that this was a unilateral decision, this travel ban, without warning, without consultation. Let's listen to what was said earlier in Brussels.
The coronavirus is a global crisis, not limited to any continent, and it requires cooperation rather than unilateral action. The European Union disapproves of the fact that the US decision to impose a travel ban was taken unilaterally and without consultation.
So really there are two issues here, right? There's, on the one hand, the decision and the way the decision was unveiled.
I mean, I think what we're seeing here is that there isn't just one way to treat this. We're talking about different strategies. We're talking about containment versus mitigation. And we keep asking as to whether or not we should do this or that, whereas I think we need to frame it as this and that. Do I think this decision was taken or the way that this decision was done was great? Well, I'm not a political scientist, but I can say that I think with a globally connected economy, I think collaboration and exchanging of data and information and resources is going to be essential. But at the same time, I just feel like we're really at a situation where, at least here in France, it's becoming quite a big public health issue. And the problem is, much like you see in the US and in different countries in the EU, is people are getting different information from governments, from health organizations as to who should quarantine, how long it should quarantine, who should self-isolate, who should social distance. So you have people that want to do good that can't because they're not getting the right information, versus what in Israel, for example, they said, look, anybody coming back from anywhere needs to quarantine for 14 days with risk of fines or imprisonment. That's a very clear mandate versus what other governments, which is like, if you feel sick, maybe, but then you can self-isolate, but maybe not. So I think there's a lot of misinformation going on.
A lot of misinformation. Joël Ruet, I know that many people, they have different views according to what time of day it is on this and how far you should go.
No, but I agree partly with what was said. We are talking about different systems, different countries, but about the same virus. It's not as if we were 7, 8, 9 weeks down the line, just like the Chinese had to discover everything about this virus. We have this track record of a few weeks, which is damn important when you have an epidemic, which is, after all, an exponential. And it just looks as if this basic information is not shared, the basic practices. Take social distancing. There's no doubt social distancing is a very good way of looking at things. Now, where's the right size? What are the practices? Italy took different steps to close the restaurants, the bars, and etc. France is taking different steps. Different countries take different steps. Is it not that one can have a learning about the right pace of social distancing and the right level? Do you need to close social distancing at the level of interpeople interactions within a city or at the borders level? If you do that at the border level, then you affect the economy, and that's just different. Then you blur issues. It's no longer epidemics with facts. It's having a contagion on something else, which is the economy.
Respectfully, if you don't mind me interjecting, every virus is different. Right now, whether we like it or not, we're running an international experiment on which way is the best way to contain the impact of this virus in different countries. Whatever we learn in this epidemic will not apply to the next epidemic, and there will be one, just as there was the West African Ebola outbreak and Zika and so on and so forth, flu, you name it. Every virus behaves differently, and every virus will need a different response. What is happening right now has never happened before, and hopefully will never happen again. The first country that will get a new epidemic will learn. The rest of us have to follow suit and implement the best possible measures.
But that's the interesting learning, I think, because when you look at, and I think you framed it as social distancing, and social distancing is asking, you could say, an almost scientific question, which is, what is the right locus of control through which you obtain the best possible social distancing? If you take a small country like Israel, you take Singapore, you take Hong Kong, which basically has shut down its border to mainland China, even though you can't call it a border. But take the US. In the US, look at the movement, how many cases you probably have in the US, intra-US. You have the biggest sort of places is in northwestern US, where probably the number of Europeans who come. Now, will this affect and bring less infected people to the US? Probably, but will it solve the issue that within the US you still can have an explosive growth of this, and because they have a total lack of testing facilities, therefore you have already a quite disproportionate high number of deaths compared to the number of cases they have? That is a completely different issue. My hypothesis is that Donald Trump has said it this way in order to frame it as an outside enemy, so to detract the attention from the fact that the US government is hopelessly unprepared. He fired the epidemic coordination group in the National Security Council.
He had to cover with the sheer neglect he gave to preparing.
Exactly. And so now you find an easy scapegoat, but it's not the solution to the social distancing that the US needs, that we need, that China needs.
Let's look at the numbers that we have here. And again, as you correctly said, Joël Ruet, it's one virus, different responses. It's not yet been 3 months since the first case was pinpointed as such, yet China claims its drastic lockdown has worked. And as the numbers level off there, they continue to skyrocket elsewhere, as you can see on this graph. And then there's the question, and Jakob Hessler just brought it up, of how solid the science is, and that depends on the testing. South Korea, an outlier when it comes to testing. They've tested many more people. We did the math. It's something like 0.8% of cases are fatal in South Korea. But again, they've tested many more people. The mortality rate is much lower comparatively to here, for instance, where it's above 2% if you look at those
but we only test people here who already have very severe symptoms.
So,
which, given
and
the
I need to add that the Korean population is a skewed statistic because it was generally younger-aged female supporters of this particular Christian sect. So please bear that in mind when you're looking at that percentage. It's actually a little bit artificial.
It's
so
the
are
same
we
for- it's
anywhere?
the same for Germany.
Dr. Moskos, are we any closer today on March the 12th to knowing, well, just how deadly COVID-19 is?
I think overall, if you start adjusting the data, for example, the average age population in the north of Italy versus the age population in Korea, and information around comorbidities, so that's additional diseases that make your chances worse, the numbers pretty much match out worldwide. The issue highlighted earlier intensely enough, and I will equally echo it, is that some countries are not putting the appropriate measurement in place, and it's a classical streetlight problem. If you're looking in the wrong place for information, you're never going to find it. If you're not looking at all, you're not going to find anything. So what's happening politically has nothing to do with what's happening medically. Coming back to the mortality percentages, the numbers that we have heard so far seem to be correct. 80% of the people that will present with symptoms will have mild symptoms, 20% will need medical attention. It looks like 10% will require intensive care, and this is the problem. And then we've got this average 2-3% that seems to be the ones that are at risk of death at very high ages or health problems.
So, Ralph Arfouche, is our political leadership reacting in the proportionate manner?
I don't think so. I think that we should be doing a lot more. Again, we have a toolkit of different options at our disposal that we can be using, and it's about finding the one that's right for the country. I think the biggest piece that we're missing here is the way that we're framing this issue. And I think when we talk about data, we're talking about COVID data, but we're not talking about, in Italy, for example, the people who died because they couldn't access medical care for other injuries. Italian hospitals were not treating trauma victims. They weren't treating stroke victims. They weren't treating people that were having heart attacks. What is that going to do? What are those numbers there? And the biggest issue that I'm having is that because this disease, because most people will be okay, because you'll be okay and I'll be okay, we're asking people to do something that socially and culturally requires them to act in the best interest of their community.
To show solidarity. Yeah. We're going to pick up on that point. We have to take a very quick break. Stay with us. You're watching the France 24 debate. Welcome back, or welcome if you're just joining us. It's the France 24 debate, and the entire planet rattled, especially markets, as more and more nations shut borders in response to the COVID-19 outbreak. We're talking about it with economist Joël Ruet, president of the Bridge Tank. Welcome back as well to commentator Jakob Hessler, sociologist Ralph Arfouche, founder of the Red Thread Institute for Digital Culture and adjunct professor at the French Political Science Institute, Sciences Po, and joining us from Newcastle in England, Dr. Stergios Moskos, molecular virologist at Northumbria University. We were talking in part one of our discussion about Donald Trump shutting the border. You agree, Ralph Arfouche, with what Jakob Hessler said, a political response to a medical problem?
Yes, I think we can all agree, as I think people were mentioning in the clip before, that the virus doesn't respect borders and it doesn't respect citizenships. This is something that is going to impact every single country. So I do think, however, that more can be done, especially in France, in terms of the social mobilization of what we should all be considering to be our civic duty, what we can each be doing to move away from containment and into mitigation. We're going to have overburdened healthcare systems. We're going to have people that are getting ill, and we don't want to see similar things happen. So we should be doing what each individual can do now. everyone should do their part. And I think that's a really difficult thing to ask people because people think, oh, it's not a threat to me, so I can kind of go on as before.
And we're seeing variable reactions across Europe, while Austria is stopping Italians who can't prove they've tested negative for COVID-19. The Czech Republic declaring a state of emergency that includes a travel ban on citizens from 15 countries, including the likes of not just China and South Korea, but also Italy, France, and much more. Czech citizens forbidden from going to those countries. Restaurants must close by 8 p.m. Refreshments at shopping malls will be banned altogether. Neighboring Slovakia going even further, Jakob Hassler, banning all travelers from everywhere except Poland.
Well, see, there you go. Fortunately, Poles are a special people within the European Union. We know that also in legal terms they have a lot of special rights, it seems. No, but on a more serious note, I think the real issue we're talking about, and why are we talking about the social distancing? It is because, exactly as you say, we need to make sure that we don't overburden the health system. So the reality of this is we're probably not going to stop the longer term infection. I think Angela Merkel maybe is a pessimist voice, but she has said it's probably 60 to 70% of us will get it. But it makes a huge difference whether we all get it by December in a very slow rise fashion, or whether we all have got it by the summer, in which case what happens is, what will all the other diseases have? In Wuhan, if you read the stories of the people, if you had any disease and you wanted to go to the hospital, you were only admitted if you could prove you were actually positive. But then there were no more tests. So the number of people who died because they were denied access to care because of some rules, we haven't yet done the full accounting of the impact. France has every year between 8 and 13,000 people dying from the flu. So this year it was exceptionally low thanks to the strikes. Like in 1995, when there's a strike,
So there's transit strikes here in France.
Yeah, because there's a lot less with strikes. There's a lot less flu. So the epidemic of the flu in France was much lower this year than any other year. But usually, in usual years, we have between 8 and 13,000 people who die. Now, people who have the flu, what do you do with them? What do you do with the SAMU when you call the ambulance in Paris?
Paramedics.
Now, the paramedics, there is such a mess yesterday that people, I know a personal case, someone coming to support someone to give birth in a home because she wanted to call the SAMU and there was no more ambulance to get to the hospital. And these cases and the saturation of the system is what we need to really work on and what the measures should be directed at.
Joël Royer, do you think France is prepared for the next level?
France is neither less nor more prepared than any other country. I think globally we have a shared problem, which is a disjunct between science and the social and economic implications. On the science side, there is a learning process. It's a new process. It took a few weeks to learn. It would have taken the next few weeks to disseminate the learning and the lessons and etc. And there comes the issue of social distancing. Social distancing is understandable from the point of view of curbing an epidemics. The only question is what's the right locus, it has been said. Should it be at the level of the household, the Chinese way? Should it be at the level of the border, the American way? Most likely it's in between. Now the problem is that until and unless we have a learning on the right scale of doing this social distancing, on the right measures, then we transform a problem which is medical into a political problem and into an economic problem. If you lock everyone home, you destroy the economy. If you close the borders but let everyone circulate, you will log the hospitals, but you will still destroy the economy because it's not just money, it's not just goods that circulate, it's also people in a modern economy with services. So to find the
really
right...
destroy the economy, or will it just put it on hold? That we just, we have to wait it out. We got to sit it out.
I like your question. If we wouldn't have stocks, if we wouldn't have bearish stocks, we would just put it on hold. But we have stocks, we have bearish stocks, and they amplify the problem. And there we come with solutions which are false solutions. To everyone who has a hammer, he wants to see the problem of being a nail. You know, he sees every problem as being a nail. So Here, we don't have a financial crisis. We have an economic crisis, and we don't even have an economic crisis. We have a stocks crisis. That's absolutely different.
It's a supply chain crisis.
All right.
It's a supply chain pause. It's not a crisis yet.
Dr. Moskos, where you are in the north of England, not many people have a lot of money in the market. And so what's the view as to, in this case, taking your medicine means of a quarantining of entire nations, possibly?
That's a very difficult question to answer. I'm afraid I'll have to admit that I'm not a local to the Northeast. I live in the Northeast for the last 3 years, and it would be inappropriate for me to comment about what the local people think as much. I've not become that much a member of the community.
Well, let me ask you what you think on this, Dr. Moskos. Is look, the economic pain, well, that's just something you have to do right now.
It's worth it. No, I'm sorry. We have to put our priorities right. If we're not going to actually stop the healthcare systems from collapsing, the damage to the economy is going to be very different. So I agree we have to decide on what functions are essential and maintaining those functions. And hey, look at the Chinese. They still manage to get the food on the streets. They still manage to get the medicines as much as possible in the rest of the country on the streets. So let's get our priorities right and then think about how we will sustain the economic activity in the recovery phase. Now, there were some announcements from central banks. I believe in Italy, they said they're going to suspend payments for mortgages for 3 months. Here in the UK, some banks have advised that they will not, I believe, charge interest, or they will offer some bridging loans at very low interest because of the outbreak. There are tools that can be taken to support people. But we have to make sure that society goes through this, that we can do everything that we need to make sure society goes through this, and then we restore function.
Rav Harfouch?
I think that's absolutely right, but let's not forget that we are in a digital age, we're in a technology age. There are things that we can do to support local businesses. I would encourage everybody to buy gift certificates of their local mom and pop shops. I'm very connected to a lot of the people that own restaurants here. One of my favorite restaurants, Holy Belly, they posted that they were empty, that they were struggling after the protests, after the strikes. And if you can't go in person to visit them, buy gift certificates. We need to help these small businesses. So there are ways that we can innovate. There are ways people are working from home. People are finding other solutions. Museums are giving virtual tours. Businesses are coming together. So let's not just say, okay, we're going to quarantine, we're going to shut everything down because of the stock market. Let's say, what can we possibly do to help make sure that all the small businesses, the entrepreneurs, the gig economy workers, all of the baristas and the bartenders and the servers and the people who can't stay home, the people who can't afford to self-quarantine, what can we do to support them? Because that's going to be a really big cost.
And what about what's been happening in the United States this week with the sudden shutting down of college campuses?
I mean, while that's concerning, I will say that the good news is that most of colleges and most of the universities have online learning. Most of the students have shifted to online learning. So that is going to be a bit disruptive, but they're still getting access to their education, which I think is great. So we have the tools in place. We have these tools. We should use them, but we should also not forget that not everybody has the privilege of just being able to stay at home. And I love France's entrepreneurial community. I love the small business community, the artisan community. We should be putting plans in place to help support them, because Google can send all their employees to work from home. They're fine. I want to make sure as a citizen, as a Parisian, that we don't forget our friends that are running these local businesses that are so important to the heart of our city.
And I think I agree with that, but I think that in a way, all the measures we talked about, they are supply measures. They are trying to make sure that businesses are still able to provide something. The problem, if we enter into a recession, and we were already on the verge of one, or people were discussing before this whole thing exploded, when it just was sort of creeping along, is the demand. There is no point in making sure restaurants are still there and survive when people don't go, when infrastructure is not being invested in. And I think, never let a good crisis be unused. This is the moment where, in fact, the lack of infrastructure investment that Europe has been doing, it has to be remedied. We need to it sounds a bit Keynesian, but it is true. We need to spend our way out of that recession. We can't just
It's
lower
interesting
interest
you should
rates.
say that, Jakob, because there's been a lot of accusatory fingers pointed at your native Germany this Thursday.
Yes.
Saying Angela Merkel announcing, well, maybe we can run a budget deficit this year, that's nowhere near enough.
No, and it's not enough, and it's the problem, as always, that Germany, through its very peculiar historic lens, is distorting and imposing something on Europe, which I think is detrimental, which, you can ask yourself, why did Brexit happen? And I'm really not a friend of Brexit. But
Okay.
that's where the break line of Europe will come. And if we don't do this, Europe will become under much more stress once this crisis is
Yeah, but
over.
you can't just confuse 1,000. Like, there are so many complicated things. I think the part of the issue of dealing with this is everyone's talking about, well, Brexit and supply chains and borders and everything. Like, what people need right now is clear guidelines on what they can do as an individual level, what they can do for their teams and organizations, and then what we can do as a country. Anything else than that is just nothing but philosophy.
But
and
no,
I know
no.
you're saying that, like, demand and supply, but we're talking about people's lives here. We're talking about people's lives.
But we're
and
talking about people's life as a politician. As politicians, we need to take care of people's lives for the next 2 months to make sure that we survive, which is all the things about social distancing. But we also need to make sure that life goes on beyond that. We can't getting into this hole, and then when we come out, everything is lost.
We've lost nearly a month not taking lessons from Asia about the people's life, about the organization's life. I agree. Now, the pressing subject is to recover the time. And the second pressing subject, or maybe at par, is to see what would be the economic answer to those organizations. The economic answer cannot be through finance. It cannot be just through budget. It cannot go just the way we saved and rescued the systemic banks 12 years ago. It has to be through the commercial banks, it has to be through the local banks, it has to be through the banks that support the entrepreneurs, the companies.
All right, on that score,
the owner of the bar.
Let's listen on that score to the head of the European Central Bank. It's not every day that the head of the ECB blasts EU governments. That's exactly what the newly appointed Christine Lagarde did this Thursday.
I tell you what I'm particularly worried about. It would be the complacency and slow motion process that would be demonstrated by the fiscal authorities of the euro area in particular.
All right, great words, except markets went through the floor after she said that, because what they wanted was an interest rate cut.
Well, and they need an interest rate cut at the top level, and they need free loans for the small entrepreneurs, the small shops, because whether we want it or not, even if we have a supply shock, there will be a demand problem, and I agree with that. And then people, the small entrepreneurs, the small factories, the small restaurants, bartenders, or whatever, people in service, will have a hole in their income, and they need money to cover that, and it should be at free cost.
But the interest
If I
rate
may, I'm sorry, we need to refocus to the point that our colleague just made about advice that we need to provide to the people. So I will start with a very simple advice. Wash those hands, number one. Number two, keep space with your colleagues, keep space with your friends. At home, if you've got symptoms, stay in one room. Number three, if you have a small business, think about taking that business away from where you are, where your customer comes to you, to the customer itself. People will still want to have a drink and they will still want to have a nice meal. You know what? Maybe it's time for that restaurant that doesn't have anybody coming through the door to start wrapping up some packages and asking the waiters to become delivery boys for a day or two, or a week or two, or a month or two. Be entrepreneurial. Let's try and solve the problem creatively. People will still have some money, some work to do. We all need to think creative and think about protecting each other and helping each other.
Jakob Hessler?
No, I agree with you. But the thing is, we need to have both debates. I think, and that's a question then to you, Francois. There are two debates, which is one, what are the clear signs and advice given to individuals on how to behave and what solidarity and civility means? And then there's a systemic debate, which is about what are we going to do so that when we come out of this mess, we come out with bruises, but not completely destroyed.
Yeah, Raha Farfouche at the end of part one was talking about how this is a test of solidarity, right? Because most of us won't have it won't be fatal for us. It's vulnerable populations, and this is about showing solidarity with those. That's at the individual level. Of course, at the national level, there's the question of what to do there. With Germany and France last week failing to answer Italy's plea for face masks, and China since stepping in, pledging 2 million of them, as well as sending doctors to Italy from Sichuan province. The President of the European Commission this Thursday calling for solidarity among the 27.
We need to support the healthcare sector urgently. I know that Italy lacks personal protective equipment, in particular respiratory devices. I asked my commissioners to work with the industry to increase the production of such equipment. And we are also working with the pharmaceutical industry to increase the supply of medicines. More solidarity is needed in Europe to make sure that doctors and nurses have the protective equipment they need and patients have the necessary treatment.
Now, Dr. Moskos, the solidarity that Ursula von der Leyen is talking about is at the national level, at the European level. Is there enough of it?
Don't forget you're speaking to a Greek. Okay, so the word solidarity means a few more things to me than it means to the rest of you. And I'm hoping this is going to be the last time Europe expresses its solidarity when the core of Europe actually feels at risk. I'll stop there.
Jakob Hessler, is how much of a leadership test is this for the European Union at this point? Is it on par with the Greek crisis? Is it on par with what we've seen?
I think
in
so
past years?
far it's not framed as a European response, which is, I'm not sure it's a leadership crisis. It's a missed opportunity to show how Europe can be relevant for the citizens in helping to address this problem. Now, that being said, for the time being, healthcare policy is not part of the core portfolio of what the EU Commission is supposed to regulate, which is why naturally the thing we are looking and expecting from Europe is then the economic and fiscal and financial policy and rules and stimuli, and but it's an opportunity to, of course, help.
But the medical industry, I mean the drugs industry and the medical industry, those masks and etc., they slightly fall under the regulations.
And we've seen pan-European efforts in the race to find a treatment.
Well, because not even for the treatment, it's been extremely late at the beginning. This was a Chinese disease, full stop, each individual European countries and the EU itself have been extremely long putting budgets on science and research. That's one. Two, the industry. We have a vibrant industry, and the industry is still regulated or partly regulated by the EU. Industry can be versatile. I'm not saying it's easy to convert a plant, a factory that's not producing masks into a plant that is producing one, but if the Chinese can create a hospital in 2 weeks, which we cannot, we can convert our industry. So solidarity should also come from...
Why can't we do it?
But also,
I'm sorry. Hang on. China's far behind us in terms of development.
I'm happy you contradict me, because I've been the Chinese on this plateau many times, and it's what people say. People say, it's a political gesture. I'm happy you contradict me, because I feel like you. We could start building more hospitals. We could convert the industry, and we haven't done. And I agree completely with you, as what you've said from a Greek perspective. There has been a divide within the EU from the north side and the southern side. And this is a time where we're at test. We use this crisis, and the EU survives by giving real solutions to real companies, the real people, or this will collapse.
Let's not also forget that France has some of the most respected scientific, computer engineering, data analytics scientists and experts in the world. And when you look at, for example, Italy's government, they have done an excellent job of sharing the data publicly. They're on GitHub. They're making everything public, available to other scientists. Let's also use some of our expertise to collaborate that way. Let's be sharing data, sharing our research, opening up all of that data sets.
Mind you, France has been doing that with China.
Yeah.
The US have not been interested in doing that with China, neither with China nor with
anybody.
They've
made the meetings confidential about the meeting.
The CDC has tried, on record, to engage with the Chinese authority very early on and they were rebuked several times. So at one point, the CDC stopped. Now we can, but I think the French have been engaging, and there are now tests for several drug varieties that have started, serious tests here in Paris that are taking place. The scientific community is actually much more connected than the others.
It is about long-term relations and preparedness. There has been a Pasteur Institute in China. There has been, there have been relations. So this solidarity is difficult to express overnight if it hasn't been prepared. Now, in some emergency case, it should, but it's also about thinking long-term.
It's also about thinking long-term. And before we leave, let's get a sense of the new normal in Rome. The Reuters news agency sent one of its video journalists out on a Vespa. And as you can see, it looks like Sunday morning in August, not Thursday midday in March in these images. It's not the end of the world yet, though, say the Italians. In announcing a toughening of measures, the Prime Minister, quoting the German sociologist Norbert Elias.
Tutta la durata di questa emergenza.
For this emergency, we are part of a community, and all of us are making sacrifices. This is the strength of our country, a community of individuals, as sociologist Norbert Elias would say. We need to keep our distance today in order to be able to hug each other with greater warmth and to run more quickly tomorrow. Together, we can do it.
Tutti insieme ce la faremo.
All right, that's it for this community of individuals for now. I want to thank you so much for joining us. I want to thank Joël Ruyer, Jakob Hessler, Ralph Harfouche, and Stergios Moskos for being with us from Newcastle. Thank you for being with us here in the France 24 debate.